Here with us today is Dr. Tran, who is the spokesperson for the Asian Health Foundation. He is currently practicing internal medicine in Falls Church, Virginia. Dr. Tran will share with us the information on the hepatitis and the update news on this disease. Welcome to the Medical News Show, Dr. Tran.
Welcome to our shows and hello, Mrs. Lam.
Sir, to open the series of the liver disease, first of all, would you please tell our audience the general function of the liver in our body?
The liver is a very important organ and the biggest organ of the abdomen, and they really plays a very important roles in the digestive system. First, they will store and metabolize the protein and fat. They metabolize also and forming the clotting factors, especially vitamin K. They can store and metabolize the glucose and in responding to the demand of the body. And also they play a role in the toxifications of the toxic substance, food or chemicals when we ingest into the body. And finally they produce the bile to help to digest the fat when we eat.
So let's talk about the virus. So how many kinds of hepatitis virus, sir?
We have many different kinds of virus, and remember, virus is the smallest. The bacteria is Asian, but we don't call it because smaller than bacteria. We call it virus, and they have a number of different viruses. But for the virus causing hepatitis, we have hepatitis A virus, B virus, C virus, D virus, E virus, and as well as the other one. But I think it's very common we have A, B, C, D, E that we want to talk about later on the next shows, because they are very important virus we need to know and how to prevent them and how to treat them.
Sir, the death rate in hepatitis C is quite high, and many people tend to believe that hepatitis C is more dangerous than type A and type B. Sir, can you clarify, is this correct?
In reality, it's really hepatitis C is difficult to treat and it's causing really more problem for people. But different viruses have different kind of characters. And if you look at the screen, you can see Hep A virus rarely cause a chronic liver problem, usually causing acute problem. B and C can cause acute chronic liver disease as well as cancer. And D only living alongside with Hep B, we call co-infection. So the D cannot causing the problem by itself, but they have to combine with the virus B to causing liver problem. And finally, E is very important because E causing more acute problem on pregnant women, and then usually cause high mortality. And also can cause hepatitis in human being and animals such as deers or whatever's in the animals, they can cause a liver problem as well, like human beings.
So how does the hepatitis C transmit? Is it different from type A and type B?
Well, C mainly is transmit to the blood by contact as well. A mainly to the food and the waters and contaminated water. So you can see much different later. We can talk how different these viruses, because the virus A completely different B and C, etc.
Today we're going to talk about hepatitis A only. Would you please tell us where was the hepatitis A virus were found, and what does it look like?
The virus A is found mainly in the contaminated waters and feces, because the patient really secrete the substance mostly to the feces, and the feces go down to the waters. But in the waters, the virus can stay longer when they live inside the body of the clams, oysters, and mussels, mostly seafood. So remember, people can get the disease to contaminated waters, or when they eat raw food, oysters and things like that. But it's very important because sometimes the virus can be transmitted by the food handlers, mean when they carry the food from the farm to the store, or when they handle the food in the restaurant, if they don't wear gloves or if they're sick, they can really spread the virus to other people that way. So food handlers is also very important because they can transmit the virus to the other area. I remember, I think 4, 5, 6 years ago, is one that's happened in Mexico when the Horn community got sick because of they eat strawberry infected with the virus A.
How does it look like? Can you describe the virus?
The virus, really, if you look on the screen, you can see the microscopic pictures of the liver. The blue one is the liver cell, and the green one, the tiny one, really this is the virus A. If you look at the pictures, very nice pictures, that are real pictures of the virus A. They have capsules and the nucleus inside, they have the DNA inside, so they can really reproduce or replicate by themselves. So that's the pictures of the virus A.
How does the virus transmit the disease, sir?
As I mentioned earlier, I think the virus can transmit through the food, the water. The men have sex with men we call homosexuals, the drug abusers, the food handlers, and usually in underdeveloped countries, for people who travel to this area, and but rarely it's transmitted through blood. So that's the only difference with B and C. B and C transmits mostly by contact and blood, but A from food, seafood, oysters, and food handlers.
So when the person infected with the hepatitis A virus, what are the symptoms, and how does the doctor detect this virus?
The symptom is easy to remember. Is the liver is the biggest organ, usually causing abdominal pain on the right side and upper part of the abdomen, and circulates is yellow skin. We call jaundice. Yellow skin because the patient become a little bit yellow, and especially the urine become very dark. And you look at the urine, it look like dark tea. So 3 symptoms, remember, it's just abdominal pain, jaundice, and dark urine. That's mentioned about the hepatitis. But to find out exactly what the virus causing this, just simple blood tests. Most of the time, we can identify A, B, or C that may cause the problem for these patients.
Now let's talk about the treatment. How do you treat hepatitis A virus, and can this virus be completely cured?
Unfortunately, right now we don't have the treatment for acute hepatitis A. The only thing we can do is to support them to maintain the nutrition, to give an IV fluid, to help the body to fight back against the virus. But the good news is, most of the time, majority of the patients, they recover themselves, but only a small percentage will develop really problems and liver failure and may die. But the mortality is very, very small. I think that's good things about the virus A. And now we have the vaccine, very effective. Hopefully we can talk a little bit more about the vaccine later.
So what are the most effective way to prevent this hepatitis A virus, then?
The best way is really to handle the food, try not to eat some kind of raw seafood, oyster, clam, and mussels. Make sure you cook very well, and be careful about the vegetables that carry from the other country. And I think everybody needs to pay attention on the vegetable. They have to really make sure that everything is clean. And the people who really handle the food handler, need to be very, very careful, wear gloves when they prepare food or something for other people to use.
So earlier you mentioned about the vaccine for the hepatitis A virus. Can you tell us how effective this vaccine, and how does vaccine protect our body?
Very effective, because right now we have the Hep A vaccine, 2 types. The first one is inactivated virus, means using worldwide right now. The virus was killed or inactivated. The second group of vaccine is still, virus still alive, but it's very attenuated, is making weakens virus, and only used in China. And very effective because it can be given to children, given to adults, people who travel to other country, and very effective that can protect the body up to 10 to 20 years later. And also if you give vaccine, when you expose to the virus, hopefully the vaccine can protect that person also if the vaccine was given 2 weeks after exposure to the virus.
So before closing the medical news show, can you share with us the newest information that you learned from the liver meeting about the hepatitis A virus today and in the future?
The only thing we learned, because most experts know that the virus A exists on Earth over 2,000 years, and the virus hepatitis was described by Hippocrates, the father of medicine nowadays, and he knows that the causing by something. He did not really believe this from the something outside, wind or some toxic or ghost. He believed that something that causing this, but he couldn't really figure out until now. With the technology, we know for sure this different virus can cause different disease of the liver. Up until Hippocrates, until now 2007, then the first time the world should get together in Miami, Florida, and they discuss about the virus, and they figure out how to really eradicate the virus. And they still believe that they can do it, because if they can provide the vaccine all over the world to the developing country, and we give the vaccine to all the children in the world, hopefully we can eradicate the virus A in the future, maybe in 1 or 2 decades in the future. The same thing happened to polio virus, that causing the paralysis or weakness in the leg of most of the children in the world, because they didn't have vaccine in the past. But now it's very rarely happened, because we almost eradicate the polio virus. Hopefully the same thing happened to virus A, that we can eradicate this in the future.
That's all the time we have for today's show. So we will continue our conversation on the hepatitis virus next time. Thanks, Dr. Tran, for joining us.
Thank you for watching our shows, and again, thanks, Mrs. Lam.
Thank you, sir. That was Dr. Sang Tran, who just shared with us on the hepatitis A virus and the update information on this liver disease. In the next edition of the medical news, we will talk about the hepatitis B and its complication, as well as how to treat it and how to prevent it. Please stay tuned. We hope the information that Dr. Tran had provided tonight has shed some light on the liver disease. That is all the time we have for this edition. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the medical news.